Let's see some more strategies here on how microbes can evade phagocytosis. We had the first two already, and so now some bacteria, they can lyse phagocytes. They can form a membrane attack complex, like we will see with the complement system. In this category would be Listeria monocytogenes. Some of them can escape the phagosome. There will be Shigella and Rickettsias, and some prevent phagosome-lysosome fusion. That's true for HIV and Mycobacterium tuberculosis. And some simply survive the phagolysosome. That's Coxiella burnetii. Now let's move on to inflammation. There are 4 cardinal signs of inflammation. They include redness, swelling, pain, and heat. So these symptoms are so severe that in the days of the old Greek physicians, the original ones, I guess, they labeled inflammation as a disease, and they described inflammation as a disease with 4 cardinal symptoms. And so they wrote it in Latin, and they said the redness, that's the rubor, and the swelling is the tumor, the pain is the dolor, and the heat is the calor. Those of you who speak Spanish, I'm sure you can recognize this. Rubor, the redness, tumor, the swelling, dolor, the pain, and calor, the heat. So the 4 cardinal signs of inflammation. Now, there's a reason why your body responds this way. So basically, the main purpose is to limit the pathogen that's invading or trying to invade you to a local area. So you want to try to destroy the agent and limit its effect on the body, and specifically you want to limit the migration or further invasion into your body. And then also inflammation contributes to repair of tissue and replacement of tissue that was damaged by the pathogen. So let's see how inflammation works. Inflammation activates acute phase proteins by the liver that cause mostly vasodilation and increased permeability of blood vessels. That means you want to recruit more white blood cells to the area to help out. So you need more workers that help you with taking care of the invasion, the local invasion. So major contributors of these acute phase proteins are histamine, increasing permeability by a lot. That is vascular permeability. Kinins, prostaglandins contribute to the pain and also to more inflammation. And then we have leukotrienes and cytokines. All of them are contributing to more inflammation. And that, again, contributes to more of the signs of the swelling, which is due to increased blood flow to the area. So you get the swelling there, also the heat. And some of the pain mostly comes from the prostaglandins, and then redness, of course, more blood flow. So here would be the process of inflammation. So here tissue damage occurs. There's some sharp item that has pricked the skin, and now some bacteria was sitting on there and they entered the skin. So here is this whatever cut is going through the skin. So now you have the release of histamine, kinins, prostaglandins, leukotrienes, cytokines, and so these are all these chemicals in these blue dots right there. They're released by the damaged skins, and they're trying to recruit help over to the area. You also are going to have a clotting reaction to seal the area, the injured area, so that you don't lose too much blood. And then you're starting to have these phagocytes basically coming in. So phagocyte migration and phagocytosis. The first thing that's going to happen is called margination. That means all of these substances that were released by the damaged tissue, they are attracting phagocytic cells. And now they need to stop the flow in the blood and basically stick to the walls, the blood vessel walls, and then migrate into the tissue area. So margination is the sticking of phagocytes to blood vessels in response to cytokines at the site of inflammation. Once these phagocytic cells are stopping their flow, and then they're going to have to squeeze between two endothelial cells of a blood vessel, and that is called diapedesis. And please, these are two terms that I would like you to know. Diapedesis, dia means between. So these phagocytes, they squeeze between endothelial cells of the blood vessels and then migrate into the area where they're being called to. So here is the process of margination and then diapedesis. Margination, the phagocytes, they will stick to the blood vessel endothelium, and that's happening right here. So this monocyte is sticking here to this blood vessel wall. And then we have diapedesis. Now this white blood cell is squeezing between two endothelial cells, squeezing through here to migrate into the area of need. And then phagocytosis happens, where the invading bacteria being eaten up by the white blood cells, by the phagocytes. Eventually, we'll want to repair the damaged tissue, but that cannot happen until all the harmful substances have been removed or neutralized. And so here's an image showing you tissue repair. So you have a blood clot and a scab that formed on top to seal everything off. And then here you are going to regenerate the parenchyma and the stroma. Okay, now let's take a look at fever next. So fever is an abnormally high body temperature. So that bears the question, what's normal? Well, normal is 37 degrees Celsius, and that's set by the hypothalamus. If you have some sort of inflammation going on or some infection, then cytokines, they may cause the hypothalamus to release prostaglandins, those are fever-inducing substances, to reset the hypothalamus to a higher temperature. And the way your body raises the temperature will constrict blood vessels, and then you first start shivering. So these muscle contractions, they will raise the temperature. And then as the temperature, this should be rises, that's when you're going to have vasodilation and sweating that occurs. Now, you may not like fever, and usually it makes you feel terrible when you have a fever, but it's actually a good thing. It helps you to heal faster, and there's actually a reason behind the fever. It increases the rate at which your enzymes work, and it does make you heal faster. There were some trials done with non-steroidal anti-inflammatory drugs such as ibuprofen. They will inhibit the prostaglandin synthesis, and so they are fever reducers and painkillers, because prostaglandins also cause pain. And some trials were done. It's like, does it prolong the disease progression if you're taking ibuprofen? And the answer was, well, in some cases it does, and it was significant. So you may feel better, but then you just have to deal with the disease longer. So that was sort of the take-home message. But in some cases, it wasn't really a significant difference. But anyway, so that's fever. Moving on to the complement system. The complement system is a set of enzymes, a cascade of enzymes that are getting activated sequentially and ultimately lead to something called the membrane attack complex. They also lead to enhancement of inflammation and also some opsonization. We'll see that in a bit. So basically, these are serum proteins. The complement system consists of a set of serum proteins that are produced by the liver. They assist the immune system in destroying microbes. Therefore, since it's an assisting system, the complement system. They act in a cascade, so it's sequential events that need to be set in motion, and these sort of these falling dominoes, that's called complement activation. Proteins are designated with uppercase C for complement, and then number in the order. Basically, it goes not just in the order that they were discovered, but also in the order that they work, pretty much, with a couple exceptions. And then the fragments of these complement components, they get a lowercase a and b. So let's take a look at one of the pathways that you can use to activate complement, and that's the classic pathway. In the classic pathway, you already have to have an antibody, and this antibody will have to bind to an antigen, and that will activate the first component of complement, which is C1. C1 then splits and activates the second and fourth component of complement, C2 and C4. C2 2 and C4 will split into C2A and C2B and C4A and C4B, and then C2A and C4B combine and activate C3. Once you're activating C3, that's the critical thing that needs to happen for complement to be fully activated. C3, the third component of complement, will split into C3A and C3B, and C3A functions in inflammation, and C3B functions in cytolysis and opsonization, which are the three things, collectively, these are the three things that we need. Increased inflammation, cytolysis via membrane attack complex, and also opsonization, which is a labeling thing. So here would be the classic pathway. You have to have an antibody that has found its antigen. So this little Y-shaped letter here binds to, it's an antibody that has found its antigen. And now once the antibody binds to the antigen, down here at the stem region of the letter Y here, of this antibody, once the arm portions of the antibody bind to the antigen, the binding site for C1 becomes available on the stem portion of the antibody. And so C1 will bind then to this binding site that has now just opened up, and it will activate C2 and C4. C2 and C4 will both split into C2A and C2B, C4A and C4B. Together, these two guys, C2A and C4B, they will activate C3. Once C3 is activated, no holding back, you will get enhancement of inflammation, you will get more opsonization, and you will also get a membrane attack complex, so cytolysis. Now C3 will split into C3A and C3B, and once the C3 is activated, well, then you are going to get the three effects: the inflammation, enhancement, opsonization, and the membrane attack complex. So here the C3 splitting into C3A and C3B. So, okay. Now, there are alternative ways of activating complement, and so here, option B is the alternative pathway. So first we had the classical pathway, now we have the alternative pathway. In the alternative pathway, you have a lipid-carbohydrate complex on the surface of the microbe, and that happens to sort of be providing a binding site for these factors B, D, and P, and that activates C3. And remember, C3 is the critical factor that must be activated. So this is an alternative pathway to the activation of C3. Once C3 is activated, it will split into C3A and C3B, and you will get inflammation enhancement, cytolysis, and opsonization. All of them are listed down here. Kind of small, but they're there. Okay, and then there is a third pathway that you should know that's called the lectin pathway. That's another alternative to the activation of complement. In this case, macrophages ingest pathogens, releasing cytokines that then stimulate the lectin production in the liver. And now you have mannose binding lectin, MBL, that binds to mannose, and it will activate C2 and C4. And once C2 and C4 have split into their E and B components, then C2A and C4B will activate C3, and that is the critical thing that needs to happen. And there we go. Then once we activate C3, we will get the typical things of inflammation enhancement, opsonization, and cytolysis. Okay, so here's the image that goes with the lectin pathway. So basically another alternative, you need this mannose binding lectin, and that will activate C2 and C4, splitting into its subcomponents in C2A and C4B. They will activate C3, and that is what needs to be activated in order to get the effects of the complement system. So outcomes of complement activation, you will get cytolysis, opsonization, and inflammation, all three of these. Cytolysis is my favorite. That's the most dramatic thing because you are assembling a bunch of proteins. They drill a hole into the surface of a microbe, and they create what's called a membrane attack complex, or MAC complex. And you will see it's pretty dramatic. Then the contents of the microbe will leak out, and the microbe is dead. Opsonization is a way to promote the attachment of a phagocytic cell, such as a neutrophil or a macrophage, to a microbe, and then promotes it to be engulfed and internalized by this phagocytic cell. So it promotes phagocytosis. And inflammation, well, as you know, that sort of recruits more white blood cells and increases release of more histamine, promotes more of the redness and the swelling and the heat and the pain.